Set. Great. Well, good morning. Thank you all for being here today. I am grateful for the chance that I got to meet Governor Pritzker along with my Illinois colleagues because, quite frankly, we are in a public health crisis, and the role that Illinois must play on the national stage cannot be overstated. The four of us just met to catch up on what's happening on the ground and to recommit to the hard work ahead. It has been 2 months since the Supreme Court took away the constitutional right to overturn to abortion by overturning Roe v. Wade. Abortion is now banned in 16 states. It's 1 in 3 women, plus more trans and non-binary people who can become pregnant, have lost access to most or all abortion care. At least 26 states in total are expected to move to ban abortion in the coming months, putting 40 million women and people who can get pregnant at risk. Hundreds of thousands of people can no longer access the abortion care they need in their own states, and they are fleeing to places like Illinois to get care. Those who don't have the resources to travel are being forced to continue their pregnancy against their will. The reality is stark. 24 states simply can't absorb the abortion needs of all 50 states. Despite our best efforts, we won't be able to provide care for everyone. But the folks in Illinois are doing such incredible work. They are literally moving mountains to get as many people care as possible. In a moment, you'll hear from President and CEO of Planned Parenthood Illinois Action, Jennifer Welch, and President and CEO of Advocates of Planned Parenthood of the St. Louis region and Southwest Missouri, Yamelsi Rodriguez, who will share how abortion bans across the country are affecting folks here in Illinois and what they're doing to respond. I should have introduced myself. I am Alexis McGill-Johnson, the President and CEO of Planned Parenthood Action Fund. It's a heartbreaking reality that personal decisions about our lives are in the hands of elected leaders. But that's why it's critical to our health, to our freedom, and to our future that we re-elect leaders like Governor Pritzker. The governor has been an outspoken champion of abortion rights since Roe was overturned and understands the sky-high stakes of Illinois' policies around sexual and reproductive health. We are so grateful to have him leading from Springfield, and we are committed to doing everything we can to ensure he stays here. I'm going to turn it over to the governor now. Thank you.
Thank you very much, Alexis. Well, good morning, everyone. Thanks to Alexis for your very kind words and your support, and it's truly a tremendous honor to be here with some of the strongest leaders we have in the fight to protect reproductive rights in the Midwest and nationwide. Alexis McGill-Johnson has been an incredible advocate during this truly harrowing post-Roe era. This morning, I was honored to join her and other Planned Parenthood CEOs to discuss Illinois' role as an oasis for abortion care. Also joining us today is President and CEO of Advocates of Planned Parenthood of the St. Louis region and Southwest Missouri, Yamelsi Rodriguez. Yamelsi has been a steadfast leader on the front lines of dealing with the appalling abortion bans imposed by Republican politicians in Missouri. And she's served the women of Missouri and Southern Illinois with pride. It's now illegal for most women in Missouri to seek abortion care, but none of us have given up. I also want to acknowledge my partner here in Illinois and my friend, President and CEO of Planned Parenthood Illinois Action, Jennifer Welch. President Welch tirelessly works and is instrumental in helping us ensure abortion remains safe and legal in Illinois, no matter what. In times like these, Planned Parenthood's unyielding partnership cannot be overstated. I am so proud to be on this team, led by strong women, as we work to ensure Illinois remains a safe haven for people to exercise their reproductive rights and the fundamental right to privacy. I believe to my core that reproductive rights are human rights, and the Supreme Court's extreme decision to overturn Roe was a shameful right-wing abrogation of those rights. But make no mistake, The right wing may have taken away abortion rights from half of all Americans, but they've unleashed a tsunami of determined women voters and their allies who will lift up pro-choice candidates and take down the ultra-conservative fundamentalists this November. So to those anti-choice politicians, know that we are coming for you. You will lose in November. There are 2 Illinois Supreme Court races on the ballot. These are judges on the ballot. There are others below the Supreme Court who are judges on the ballot. There's U.S. Senator Tammy Duckworth on the ballot. And there are congressional races on the ballot. And in every one of these, we can and we must elect pro-choice candidates. We cannot stand by while extremist, retrograde Republican politicians and judges treat women like second-class citizens. Before Roe v. Wade, illegal abortions were the leading cause of maternal deaths, and those who were lucky enough to survive dangerous abortions were often left infertile, in pain, and traumatized. That is what happens when reproductive rights are taken away. In Illinois, some would say that we're lucky because we don't have a trigger law anymore and we passed the Reproductive Health Act. But actually, luck has nothing to do with it. It is thanks to the tireless commitment of pro-choice legislators, activists, and organizations like Planned Parenthood. I'm beyond proud to have signed pro-choice legislation that guarantees a woman's right to bodily autonomy in our state, because in Illinois, we trust women. But let me be clear, this can all be taken away if we don't re-elect a pro-choice legislature, and yes, a pro-choice governor. Illinois could easily end up like one of our neighboring anti-choice states. Darren Bailey has said clearly that he would not even allow abortion in cases of rape or incest, and he even compared it to the Holocaust. Darren Bailey's dangerous politics are a threat to women and girls everywhere. This is not a drill. This is an actual emergency. I am very proud to stand here with these committed leaders today, and I'm ready to work harder than ever alongside Planned Parenthood to elect and re-elect pro-choice, pro-women Democratic candidates up and down the ticket. So thank you for listening, and it's now my great honor to turn this podium over to one of the most important pro-choice leaders, certainly in the state of Illinois, in the Midwest, and in the nation, Jennifer Welch.
Thank you, Governor Pritzker. I'm Jennifer Welch. I'm the chair of Planned Parenthood Illinois Action PAC, and my pronouns are she, her. I agree with the governor and Alexis. There has never been a more important time to come together as we have today, because we are on the cusp of another crucial election. Because of Governor Pritzker's leadership and dedication to reproductive rights and equal access to high-quality health care, Illinois is the only option for unrestricted access to abortion in the Midwest and beyond. PPIA PAC was fortunate to work closely with the governor and partners such as the women standing behind me to make Illinois a haven in the Midwest. When the governor signed the Reproductive Health Act in 2019, he enshrined abortion care as a fundamental right in Illinois. Thanks to pro-choice champions like Governor Pritzker, Illinois is now a leader in supporting the right for people to make their own decisions about essential health care that they need, and that includes abortion. While Illinois is serving as an access point for many, our work is not done. In fact, now that Roe has been overturned, the real work is just beginning. Planned Parenthood of Illinois now serves more out-of-state patients than ever before. Approximately 30% of PPIL abortion patients are traveling here from nearly 20 different states. This is an historic high number, and patients who are forced to travel for care face tremendous barriers to getting their care that they need. Recently, PPIL worked with a college student coming from Ohio. The amazing navigation team helped that patient figure out care and travel logistics over one weekend because she had to get back to school for classes. The PPIL team helped schedule her appointment, booked her hotel room, and provided funds for food and gas cards. The navigators also worked with the Chicago Abortion Fund and the Abortion Fund of Ohio to fill in the remaining gaps in the safety net needed for her care. While that example is one of the thousands of patients coming into Illinois for care each month, Illinois residents also face barriers to care. For some, there is a lack of providers in their area, and so they have to travel long distances even within our home state. Others simply can't afford the medical care that they need. That's why Illinois must do more than just protect abortion rights. Illinois needs to protect providers and patients. We need to cut the red tape to eliminate barriers for providers and patients and allocate funds to support equitable care to access. That's why Planned Parenthood of Illinois calls for increased funding and increased protections for providers so that we can build new health centers, safe centers, and services to handle the influx of patients. We also need strong legislation to protect from potential legal action, because it's no secret that conservative politicians in surrounding states are coming for our providers and our patients. We need to do everything that we can to make sure that abortion is safe and legal and remains safe and legal here in Illinois. We also need the law to recognize that advanced practice nurses and physician's assistants can safely and legally perform abortion procedures in accordance with their scope of practice and training. In order to meet these needs, we must have supported elected officials. Everyone needs to understand that abortion is on the ballot in November. We must elect pro-choice candidates up and down the ballot, and we must re-elect Governor J.B. Pritzker. It is now my honor to introduce someone that I have the privilege of working with for a long time, President and CEO of Advocates for Planned Parenthood of the St. Louis region and Southwest Missouri, Yamelsi Rodriguez.
Thank you, Jennifer. It's great to be here with you, Alexis, and of course with Governor Pritzker. Buenos días a todos. My name is Yamelsi Rodriguez. I use she, her, ella pronouns. And as Jennifer said, I'm the president and CEO for Advocates of Planned Parenthood of the St. Louis region and Southwest Missouri. And I'm here because I know what it's like to exist in a state with extreme anti-abortion politicians that don't listen to doctors, to science, or to their constituents for that matter. 67 days ago, the last abortion clinic in Missouri, which straddles the Missouri-Illinois border, was forced to stop providing abortion services because Missouri was the first state to completely ban abortion just minutes after the Supreme Court decision came down in the Dobbs versus Jackson case. That wasn't a surprise. We all saw the writing on the wall for years. Roe was going to be overturned, and we needed to be prepared. Thankfully, Governor Pritzker and leaders in Illinois also knew that was coming, and in 2019, this state ensured that all reproductive care, including abortion, was a protected fundamental right in Illinois. Just 5 months after the Reproductive Health Act was signed, the Planned Parenthood Fairview Heights Health Center opened, one of only 2 abortion providers in southern Illinois. The health center was built to meet the needs of patients in Illinois and the estimated 14,000 additional patients who would come from other states once Roe was overturned. The surge of patients came much faster than any of us could have anticipated. Within the first week of the Dobbs decision, abortion appointment wait times at the Fairview Heights Health Center went from 3 to 4 days to 2.5 weeks. Patients continue to flood southern Illinois from all over the Midwest and the South, including patients from all over Illinois. This health center provides abortions up to 26 weeks, the farthest of any abortion provider in this state and in so many others. And the need for abortion later in pregnancy is increasing because of wait times and logistical realities for patients. In fact, Since Roe was overturned, the Planned Parenthood in Fairview Heights, Illinois, has seen a 76% increase in abortions after 14 weeks gestation. These wait times are impacting Illinois patients just as much as patients from other states. There is no time to waste, so just last week, 4 more states completely banned abortion, and more will join the list very soon. We are living, as Alexis said, in a public health crisis, and we need our leaders to bring relief to the abortion providers and support services across the state. As Jennifer mentioned, expanding the pool of providers that can perform in-clinic abortions, ensuring providers and patients are free from criminal prosecution in other states where abortion is banned, it's critical. And also the practical support that it's needed to ensure those patients who are traveling hundreds of miles to access abortion in the state of Illinois. That's why we need to elect pro-abortion candidates up and down the ballot in this midterm election, including Governor Pritzker. Thanks to Governor Pritzker signing the RHA into law 3 years ago, Illinois is a place of hope for the thousands of patients being faced to flee their home states for care. Ensuring Illinois has a pro-abortion leaders is a national issue, as Alexis mentioned, and as the governor has said, we will do everything we can to protect women in the state of Illinois and women who come to this state for care. Whether a patient is traveling 56 miles from Hillsborough, Illinois, 203 miles from Indiana, or 403 miles from Texas, because that's the only appointment she could get after searching for 3 days, everyone deserves access to abortion care. The patients are counting on Governor Pritzker to ensure that access continues to be a reality in Illinois. So to every voter in Illinois, your vote to elect pro-reproductive health care champions up and down the ballot will save lives, lives of Illinoisans and beyond. A cada votante en el estado de Illinois, tu voto para elegir campeones pro salud reproductiva arriba y abajo de la papeleta este noviembre salvará vidas, no solo las vidas de los residentes del estado de Illinois, sino más allá. Now it is my pleasure to turn it back to Governor Pritzker to answer some questions.
Oh, no, the legislators are hard at work now, I think you know, in working groups, in fact, working with Planned Parenthood and many other pro-choice organizations to make sure that they can craft the legislation that we need. You heard about the need to protect from legal liability, criminal and civil liability that other states want to bring against people in Illinois, against their own people who come to Illinois. Those are parts of what need to be addressed by the legislature. Then there's the expansion of capacity, allowing nurse practitioners to perform procedures to make sure that we're protecting and growing the existing capacity of the clinics that are here, and then attracting other clinics to come to Illinois. Those are all things that are being considered by the working groups in the legislature.
Was it a knee-jerk reaction to say on the day the decision came down that you were going to follow such a fashion, move the meat, and then move the goalposts further back? One of the reasons the legislators in Springfield and one of them going to ask on the crisis, the emergency before the hearing. You know, I have a press release from Planned Parenthood that was a couple weeks ago saying Illinois lags behind other states in the press.
Well, I think you know that there are two things that you have to consider. One is there is a legislature. The legislature has to do its work, and it is hard at work. Second, that as you know, in special session, when things need to be passed with a supermajority, that's harder than doing it with a simple majority. So there are some things that can be done and could be done with a supermajority, some things that take a simple majority. So again, the legislature is working through all those things.
But the election has nothing to do with it. That doesn't seem far. It seems as if you really are going to let yourself happen.
I'm telling you that our efforts here are ongoing every single day. The legislators are meeting every week trying to figure out. Well, we've made progress. Let me just give you one example. We increased the reimbursement rate for abortion providers in the state of Illinois by 20%. That's made a difference. I think you would hear from the people behind me, as well as the other providers across the state. Those are things we can do from an executive branch perspective, and then once again, the legislature needs to do its work.
What about the other options at the executive level, like issuing executive orders to protect providers or do other things of that sort, to at least get the ball moving?
There are things that you can't do as an executive order. There are things that the legislature really does need to do. We need it enshrined into law. And so, again, those things are all being worked out. We're talking to the legislature, working with the Attorney General's office, but making sure that we're making progress. And once again, the increase in the reimbursement rates is real progress. Oh, yeah, please, please, yeah.
As the representative of advocates of Planned Parenthood of the St. Louis region, I just want to reassure you that these are some of the conversations that we had today with Governor Pritzker of understanding how incredibly important it is that we address this health crisis, but that we actually do it in a way that's going to yield the biggest protections. As a CEO of an affiliate that has providers crossing state lines to provide abortion care, it's really, really important for us that we get that language right. And what I'm thankful for Governor Pritzker is that he's actually listening to the providers on the ground and ensuring that we are working together in a legislative agenda that it's really, really going to address the needs of providers in the bi-state region and continue to enshrine reproductive rights in Illinois.
And if that takes till after the election in November or early January, is that okay with you as long as they get it right?
I think it's more important to get it right than to get it fast, because we are the providers that are going to have to live with the decisions and what the laws are in the future. And our priority, and I'm sure Jennifer joins me in this, is to ensure that every person who needs access to abortion is able to access that care in Illinois, and that the people that are providing that care have all of the tool, resources, and legal protections to continue to offer that care for the patients who rely on us.
Do you have enough funds to last? You mentioned this became pretty at your clinic. Do you have enough funds to last until November and
I think that, Planned Parenthood has always had to straddle the mission versus ensuring that we have sustainability over time. And right now, what I can tell you is that we are relying on the generosity and support of individuals that in the wake of the Dobbs decision have decided to take a stand and, provide their support, including financial support. Is this going to be sustainable over time when we're thinking about $900 to $1,500 just to provide practical support for transportation and accommodations? No. And we made that very clear to Governor Pritzker why this is an imperative. And we will continue to work with him to ensure that we have a sustainable path long term.
Governor, off topic, since the state fair, Darren Bailey is running, they have been hammering you on crime. Stephanie Trussell, I think, is going to...
Just since then? Come on.
Well, it's a special emphasis on it. But Stephanie Trussell says you don't care about poor people, and you've done nothing to help people on the west and south side of Chicago. How do you respond to those?
That's ludicrous. Since I came into office, in fact, I've been focused on lifting up those who've been left out and left behind. When you talk about the west and south sides of Chicago or downstate Illinois, where many people are poor and in need of help. And let me be clear, it was Darren Bailey that voted against providing rent assistance or homeowners assistance during the worst parts of the pandemic. Darren Bailey, who voted against all of the assistance for small businesses during the pandemic. Darren Bailey, who voted against providing an expansion of Medicaid in the state. So it is their ticket, in fact, that is working against people who are poor in the state, people who need a little extra help, and frankly working against the middle class. I've been standing up for working people and expanding their rights. He's been voting against them every time.
You talked about that people on the right need to know that people who support abortion rights are mobilizing. Do you believe that that is enough to offset the kind of mobilization that we are seeing on the right of people who are portraying this as their movement to save lives, and that is how they are trying to get their people out there.
I think you can see, not only from polling data, but very importantly from the numbers of people who show up at abortion rights activist protests, that it is growing and growing and growing. The support that people have shown for candidates and their willingness to register to vote. Look at how many women have registered to vote around the country as compared to men, and especially in swing states. It's been very important. I think that I'm feeling across the state a real surge of momentum for candidates that are pro-choice, that are just going to stand up for women's reproductive health.
May I ask you a question related to the
Sure.
Do you stand by all of the early prison release decisions your administration has made, some of them tied to COVID, and has that been a good decision in the midst of the spike in crime that we've seen?
Well, again, let me point out that many of the releases that you're talking about were nonviolent crimes. These are people who were serving relatively shorter prison terms, and in the moment taking a couple of months off of somebody's 2-year sentence was a reasonable, rational thing to do when you were also having people die in prison because of the spread of COVID. So it's been important, I think, to be measured about it, and we were and have been. And so, and those are decisions that were made by the leader of the Department of Corrections. It's in their purview to do that. And we saved lives during the pandemic because of the decisions that we made. Thank you.
Thank you, sir.